Assalamualaikum warahmatullahi wabarakatuh. As a dental student, habits in maintaining dental and oral health are often a concern. How an overview of dental student behaviors towards dental hygiene on University of Muhammadiyah Yogyakarta, class of 2020. Okay, let me introduce myself. My name is Salsabila Zahra with student number 2020-034-0074. Okay, I will start with the introduction of my paper. The important part of general body health is maintaining oral health. Maintaining dental and oral health can be done by brushing teeth, using dental floss, and then mouthwash, and regularly check up with the dentist. Dental students have an essential role in educating and promoting dental health for family, friends, and the general public. They have also learned to know the condition of the oral cavity and can apply the knowledge that have given to them before it is introduced to the general public. This study will more discuss the description of the practice of dental students in maintaining dental and oral health. Okay, next, for the research question in this paper, for the first is how do dental students keep their dental hygiene, and the second, how do dental students apply knowledge related to maintaining oral health to themselves. Okay, next, for this paper, I use several previous study. This is the literature review. For the first is from Wijaya on 2018. He explained that health practitioners are pioneers of preventive action who have an important role in providing education on how to maintain healthy teeth and mouth. And then from Karib and Rashid on 2015, explained that dental students' overall understanding of oral health behavior was exemplary. And then from Mahemar, Kamal, Atia, Dorfer, and Conrad on 2021 explained that dental students associated higher scores of oral health, attitudes, and behavior with the conscientiousness personality dimension. Okay, from the three previous study, I developed it on arranged my research in this paper. Okay, next, this is research method. For this paper, I use quantitative study that the subjects is the second years of the dental students at the University of Muhammadiyah Yogyakarta, class of 2020. And then I used cross-sectional study, collected data, took a self-assessment questionnaire distributed to 36 students by Google Form. And then the question will be made up of 22 multiple choice questions. Some of the questions will be adapted from the HUTBI and developed by the researchers. The questionnaires for students will be sent in the form of a link from the form. And then students who fill out the questionnaire are volunteers. The researchers will send the link of the form through by the WhatsApp group. And then after the researchers get the data from the questionnaires, the researchers will immediately analyze the result. And then the researchers will conclude from the data that has been analyzed based on the participants' answer. Okay, next. This is the results of this study. It is the table about the answer of the research instrument. Okay. In these pictures, in this table, for the first question, it is about I don't worry much about visiting the dentist. The student that answer agree, it is 86.1%, and for disagree it is 13.9%. And then the question number 2 is my gums tend to bleed when I brush my teeth. For agree it is 11.1%, and then for disagree it is 88.9%. And then the third question is about I worry about the color of my teeth. For agree is it 69.4%, and then for disagree is 30.6%. And then for the fourth question, it is I have noticed some white sticky deposit on my teeth. It is for agree is 50% and the disagree 50%. And then the fifth question is I use a child-sized toothbrush. For agree is only 5.6%, and then for disagree is 94.4%. And then next, when I'm old, I don't think about wearing dentures no matter what condition my teeth are in. It is for agree is 22.2%, and the disagree is 77.8%. And then next question about I'm bothered by the color of my gums. For agree is 22.2%, and the disagree is 77.8%. And then I think my teeth are getting worse despite my daily brushing. It is for agree is 19.4%, and then for disagree is 80.6%. And then next question is I brush each of my teeth carefully. For agree is 91.7%, and the disagree is 8.3%. And then I have never been taught professionally how to brush. Agree is 8.3%, and the disagree is 91.7%. And next is I think I can clean my teeth in a mirror after brushing. Is for agree only 5.6%, and disagree is 94.4%. I often check my teeth in a mirror after brushing. Is for disagree is 88.9%, and disagree is 11.1%. And then the 13th question is I worry about having bad breath. For agree is 77.8%, and disagree is 22.2%. And then it is impossible to prevent gum disease with toothbrushing alone. For agree is 30.6%, and then disagree is 69.4%. And then I put off going to a dentist until I have a toothache. for agree is 19.4%, and then for disagree is 80.6%. And then I have used a die to see how clean my teeth are. For agree is only 2.8%, and then for disagree is 97.2%. And then I use a toothbrush that has hard bristles. Is for agree is 50.6%, and then for disagree is 94.4%. I don't feel I've brushed unless I brush with strong strokes. For agree is 19.7%, and then for disagree is 83.3%. And then for I feel I sometimes take too much time to brush my teeth, is for agree is 36.1%, and then for disagree is 63.9%. Okay, from this table we can see the dental student already understand how to take care of their teeth by visiting the dentist, and moreover they know about the size of toothbrush, the technique when brushing teeth, and care with their oral conditions. Okay, sorry. Okay, this means that the most dental students already understand how to take care of their teeth by visiting the dentist, like I said before. They already understand well for these problems. Okay, next. Discussion of this study. Okay, this study shows that most dentistry students at University of Muhammadiyah Yogyakarta have learned to maintain excellent and correct oral health. Although many of them are correct regarding maintaining dental health, some are still not accurate in applying it. This can happen because of their habits. Therefore, dental students need to change their oral hygiene habits gradually. This will later form a practice to improve dental and oral health condition. In addition, good knowledge also affect dental and oral health. Knowledge, awareness, and positive attitudes that underlie the behavior of maintaining dental and oral health will have a more real impact than without these things. Although expertise has a significant contribution to shaping dental and oral health, it needs to be supported by attitudes and action to influence the level of dental and oral health. Although it needs to be supported by attitudes and action to influence the level of dental and oral health that I said before. Okay, next. Okay, it is the last of my paper presentation. It is the conclusion. The conclusion is based on the research conducted, the description of dental students at the University of Muhammadiyah Yogyakarta class of 2020 had a good knowledge, attitude, and action in maintaining dental and oral health. This shows a relationship between the learning they get in college and their daily habits. Moreover, from this study, we can find out that dental students have a high concern for the health of their teeth and mouth. Okay, thank you. That's all from me. Wassalamualaikum warahmatullahi wabarakatuh.